السلام عليكم ورحمة الله وبركاته طلبة السمستر الثاني English 2 لطلبة كلية الطب for non-subject specialist للغة الإنجليزية لغير الاختصاص الحصة السابعة. Today we are going to talk about taking history and as you know all patients or every patient has a history. That means when he or she comes to the doctor should start having a conversation, asking questions to the patient, and the patient, of course, answers the questions back to the doctor about his case, his conditions, when did he start feeling the symptoms, or he describes the pain, or describe his, we say, complaint. So as you can see from the photos, so at the end, the doctor can have finally the data, and this data can make him decide about the condition of the patient. Of course, when you ask a question or when you ask a patient about his, we say, condition, we have some, we say, simple questions. So, for example, we ask with verb to do. So we say, do you remember? Do you remember, for example, when was the last time? When was the last time you saw a doctor? So you are asking him, or do you remember again? Do you remember when was the last time you felt this pain? So you ask a question starting with do you remember? Also, we can use present perfect with have you ever? Have you ever felt? Have you ever felt, or have you ever had any pain? Okay, so have you ever felt, or have you ever had any pain? So you use present perfect to ask about the history condition. So in this way, do you remember? Do you think? Can you tell me? So we can use these auxiliaries. Can you, could you, would you tell me? Could you tell me, please? So you ask using these expressions to talk about these issues. Now we are going to listen to the first listening today, and this is about the guide to taking medical histories. So listen, please. We are going to listen twice, and we are going to look at some of the expressions like data, complaint, history of onset, past medical history, current social history, family medical history, procedure, and allergies. So these are the expressions we are going to face, and we are going to deal with this, inshallah, this class. Listen, please, and then after that, we are going to answer the questions.
Unit 8, Taking a History, Exercise 5, page 19.
Assista Med, Guide to Taking Medical Histories. As a medical professional, you should be prepared to take thorough medical histories. The data you collect reveals important details about a patient. Doctors use these details to uncover likely causes of medical conditions and establish diagnosis. First, get as many details as possible about a patient's complaint. Find out if the patient has a history of the condition. Ask when the patient experienced the onset of symptoms. Check what makes it worse and what makes it better. Then find out about the patient's past medical history. Record any previous medical problems, especially those that could relate to the current condition. Other details can also contribute to a useful medical history. A good social history includes information about the patient's personal habits and lifestyle. A family medical history reveals conditions that are more likely to occur in a particular family. Before any medical procedure, make sure you have an updated record of the patient's allergies. This way, you avoid exposing patients to medications or substances that might harm them.
Okay, listen again, please. Listen again.
Unit 8, Taking a History. Exercise 5, page 19.
Assist the Med. Guide to Taking Medical Histories. As a medical professional, you should be prepared to take thorough medical histories. The data you collect reveals important details about a patient. Doctors use these details to uncover likely causes of medical conditions and establish diagnosis. First, get as many details as possible about a patient's complaint. Find out if the patient has a history of the condition. Ask when the patient experienced the onset of symptoms. Check what makes it worse and what makes it better. Then find out about the patient's past medical history. Record any previous medical problems, especially those that could relate to the current condition. Other details can also contribute to a useful medical history. A good social history includes information about the patient's personal habits and lifestyle. A family medical history reveals conditions that are more likely to occur in a particular family. Before any medical procedure, make sure you have an updated record of the patient's allergies. This way, you avoid exposing patients to medications or substances that might harm them.
Okay. Of course, we have this important procedure, which is taking the history of a patient. But we have now a table. If you look at question number 2 in here, read the guide. Yeah, that's the table. And we are going the guide to taking medical histories, then complete the table using information from the passage. We have type of history, information included. So we have past medical history, social history, and family medical history. So we have the 3 types of histories. We are going to ask the patient is about the past medical history of the patient. Then the social history, that means he and the surrounding of the patient. Then finally, we have the family medical history. Now, for past medical history, so information included is previous medical problems. So we have to include any previous medical problems. Any previous medical problems. This is number 1. And also problems related and problems also related to the current situation. Problems also plus the problems related to the current state or current situation. For the social history, you have to check the patient's personal habits and lifestyle for the social history. So we have to check or to ask about the patient's we say personal habits. Like eating habits, drinking habits, plus lifestyle. What kind of lifestyle? Is his lifestyle stressful? Does he do a job, a difficult job, an easy job? Indoor, that means indoor job like working in an office, or outdoor job, working in the street or in a farm, or yes, what kind of lifestyle also is important to the social history. Finally, we have family medical history. If, for example, if you are talking about heart diseases, chronic diseases, heart diseases, we say other issues related to diabetes or other diseases, you have to check about the family. So here, yes, so we are going to ask about conditions which are likely to occur in a particular family. For example, to ask about the history, if a person is diabetic, so you ask about if his father or his mother had this disease, or the family has any, we say, any previous, we say, history with that disease. Of course, taking history depends on many issues like your personality, the way you are using the language. You have to be flexible. You have to be friendly when you talk with the patient, because the patient, as you know, um, is a weak person sometimes, and these people are really tired and sick. So you have to be very patient, and you have to be very polite and friendly as while you are talking with them. Now we have a very simple exercise. We have some vocabulary. So we have data, onset, allergy, complaint, procedure, and family medical history. So we are going to match the questions 1 to 6 to definitions from A, B, C, D, E, F. Okay, let's do number 1, data. Data is number C. It is a collection of information. So to collect information, this is called data. Onset. Onset. This is one word, not on set. No, it is one word. Onset. Onset. It's the first instance of something. So you ask the patient, when was the first time you had a headache? When was the first time you had a diarrhea, for example? When was the first time or the first instance you had this allergy, for example? Number 3, allergy. It is a condition that causes a reaction or illness. So allergy. This is number D. Complaint, number 4, is a pain or illness reported by a patient. So this is F. And number 5, procedure. It is the steps taken by the doctor, the medical treatment. So it is E. And finally, family medical history is number B, a record of a patient's family conditions. Okay, these are some of the, we say, questions matching the words with their definitions. Now we are going to move to the second page. Now we have this exercise. Read the sentence pair. Choose where the words best fit the blanks. So we have history of and we have current. So number A. Paul's family has a cancer. So Paul's family has a cancer. So we say history of. The family has a history of cancer. That means many of its members, they have or they had cancer in their lives. 2, or B, the patient's condition was caused by a recent injury. So the patient's current condition, current means now, present condition, current condition. It means what is happening now, current, was caused by a recent injury. 2, social history, past medical history. So there is a difference between social history and past medical history. The patients included her previous surgeries. Previous surgeries, so operations she had in the past. So this is called history or past medical history. This is past medical history. Then number B, the patient's social history. Included her occupation. Occupation means job. What does she do? Like for example, teacher, engineer, worker, secretary. So what is her occupation? It means what is her job. Now we are going to listen again to listening number 2 today. And we are going to answer some questions about the listening. Listen to the conversation, and we have 2 questions. Again, we are going to listen 2 times. We are going to listen 2 times to the conversation between a nurse and a patient, and then we choose the correct answers. So question number 1, what is the purpose of the conversation? Question number 2, which is true about the woman? We are going to listen twice, 2 times, then we are going to answer the questions. Listen, please.
Exercises 6 and 7, page 19.
The doctor will be in shortly, Miss Granger. While you're waiting, I have a few questions about your past medical history.
Of course. What do you need to know?
You wrote on the form that you're suffering from chest pain.
Yes, I've had this problem on and off for years.
Do you remember when exactly the onset of the problem was?
Let's see. I think I first noticed it about 6 years ago.
Have you ever been treated for the condition?
No, I did see a doctor once about it, but he couldn't find the cause.
Does anyone in your family have a history of heart problems?
No, not that I know of. Do you think that could be the problem?
We don't know anything yet. We just want to get as much information as we can so the doctor can make an informed diagnosis.
Okay, listen again.
Exercises 6 and 7, page 19.
Okay, so we are going to listen to and answer question number 1. What is the purpose of the conversation?
The doctor will be in shortly, Miss Granger. While you're waiting, I have a few questions about your past medical history.
Of course. What do you need to know?
You wrote on the form that you're suffering from chest pain.
Yes, I've had this problem on and off for years.
Do you remember when exactly the onset of the problem was?
Let's see. I think I first noticed it about 6 years ago.
Have you ever been treated for the condition?
No, I did see a doctor once about it, but he couldn't find the cause.
So question number 1, What is the answer for question 1? What is the purpose of the conversation? To correct an error in the medical history, to clarify the woman's social history, to establish an appropriate treatment, or to collect data for a medical history. Yes, anyone can answer? Yes, the answer is D. Okay, now let us finish the rest. Question 2. Which is true about the woman?
Does anyone in your family have a history of heart problems?
No, not that I know of. Do you think that could be the problem?
We don't know anything yet. We just want to get as much information as we can so the doctor can make an informed diagnosis.
Which is true about the woman? Her condition comes and goes, or her condition has been treated before, or she has had the condition her whole life, or her family has a history of heart problems. So she said, my condition comes and goes. So the correct answer is A. Good, yes. So it is A. No, not the last. No, it is yes. We are going to listen again anyway, and we are going to fill, we say the gaps. We are going to fill the gaps in here. So this is the nurse asking the woman. So we are going to listen and fill the gaps with the appropriate, we say, words. Listen, please.
Exercises 6 and 7, page 19.
The doctor will be in shortly, Miss Granger. While you're waiting, I have a few questions about your past medical history.
Of course. What do you need to know?
You wrote on the form that you're suffering from chest pain.
You wrote on the form that you are suffering, You are suffering from a chest pain. Yes. Let's do number 2.
Yes, I've had this problem on and off for years.
Yes, I've had this problem on and off. So on and off, that means coming, going. On and off, that means the pain comes and goes for years. Number 3.
Do you remember when exactly the onset of the problem was?
Let's see. I think I first noticed it about 6 years ago.
Do you remember when exactly the onset? Onset, it means the start of the problem was. Onset. Let's see. I think I first noticed it about 6 years ago. Okay. 4.
Have you ever been treated for the condition?
Have you, present perfect. Have you ever been treated for the condition? The answer, number 5.
No, I did see a doctor once about it, but he couldn't find the cause.
No, I did see a doctor once about it, but he couldn't find the cause. Okay, now finally, question about the history. The question about the history of the family.
Does anyone in your family have a history of heart problems?
No, not that I know of.
Does anyone in your family have a history of heart problems? A history of. Heart problems. Okay, no, she doesn't.
Do you think that could be the problem?
We don't know anything yet. We just want to get as much information as we can so the doctor can make an informed diagnosis.
Okay, as you can see here, before the doctor checks the patient, as you can see from the topics or the exercises we are doing, that the doctor doesn't start checking the patient. The nurse or nurses actually start the job. So first, the nurse, he or she, they start asking the questions about the patient's condition. Then after that, they ask then the doctor himself or herself checks the patient. So the nurse asks the questions. Do you remember? Do you remember? We say the onset. That means, do you remember the onset of the disease or of the pain? Onset, it means the start. When did this start? Have you ever been to a doctor? Have you ever been to a doctor? That means, have you ever seen or checked by a doctor? I first noticed this, yes, 6 years ago. This is the patient's answer. When he asked the nurse asked about the onset. Do you remember the onset of the pain? Yes, I first noticed this 6 years ago. So in this way, the patient gives or talks about her history. Well, this is a very simple topic. It's not a very difficult one. And today I'm going to finish this topic with another related topic, which is Unit 9, about talking about symptoms. Because when you ask a patient about the history, so you have to ask about the symptoms. And talking about symptoms, of course, as a doctor, we have many symptoms. Symptoms sometimes the patients can explain, they can talk about, or some symptoms some symptoms the patient cannot see or notice, but you are a physician, or as a physician, as a doctor, you can see, for example, the skin. You can check the skin of the patient, the color of the eyes maybe, or the hands, or the skin conditions. You can check many symptoms. The rash, if there is a rash, or there are some other conditions in the body. So you can check, and you can, from these symptoms, you can decide, or you can start deciding about the disease. Now we have a patient. We have Linda Thomas, and she has, and that patient has some symptoms. Now we are going to listen to this again as usual, and we answer the kinds of symptoms. So we have some vocabulary here. So we have the words or the vocabulary about, we say cold, we have a runny nose, coughing, also wheezing and muscle aches, headache, throbs, and we have flu or fever, sorry. Then we have symptoms of flu. So these are some of the vocabulary related to the topic. Let's listen and then start answering the questions as usual.
Unit 9, Talking about Symptoms. Exercise 5, page 21.
Patient, Linda Thomas. DOB 110679. Patient presented today with discomfort in her head and body. She said she was treated for a cold last month by another doctor, and she was worried it might have returned. Once again, she has a runny nose and is coughing. She is experiencing severe fatigue and difficulty concentrating, also as before. However, she is now also wheezing and having trouble breathing. She also reports muscle aches all over her body and a headache that throbs. The pain and laboured breathing are preventing the patient from sleeping comfortably. A temperature reading indicated a fever of 102 degrees. I advised the patient that her symptoms suggest flu rather than a cold. I recommended an over-the-counter analgesic to relieve pain and reduce the fever. I also advised the patient to stay home for 2 to 3 days. She should also drink plenty of fluids until she feels stronger. The patient will return in 7 to 10 days if the symptoms do not improve.
Okay, so it was flu. Her condition is diagnosed by the doctor as a flu, not cold. Okay, nowadays we have coronavirus, and maybe these symptoms are the symptoms of corona. I don't know. I'm not a physician anyway. Let's listen again to that. Yes, I like the way the doctor is talking. She's very confident. She talks slowly to describe the condition of the patient. Listen, please.
Unit 9, Talking about Symptoms. Exercise 5, page 21.
Patient, Linda Thomas. DOB 110679. Patient presented today with discomfort in her head and body. She said she was treated for a cold last month by another doctor, and she was worried it might have returned. Once again, she has a runny nose and is coughing. She is experiencing severe fatigue and difficulty concentrating, also as before. However, she is now also wheezing and having trouble breathing. She also reports muscle aches all over her body and a headache that throbs. The pain and laboured breathing are preventing the patient from sleeping comfortably. A temperature reading indicated a fever of 102 degrees. I advised the patient that her symptoms suggest flu rather than a cold. I recommended an over-the-counter analgesic to relieve pain and reduce the fever. I also advised the patient to stay home for 2 to 3 days. She should also drink plenty of fluids until she feels stronger. The patient will return in 7 to 10 days if the symptoms do not improve.
Okay, now we are going to answer the questions. If I ask a question, what is the importance of describing symptoms? And what are some symptoms of flu? So we have the importance of describing symptoms, of course, that they can help the doctor diagnose the disease. Of course, the more the patient is accurate, or the more accurate details he give or she give, the more details he or she gives to the doctor, of course the doctor can diagnose the disease easier and faster. What are some of the symptoms of the flu? As you heard here, she has a headache, throbbing pain, muscle aches, or muscles ache around her body, and of course she has a fever, 102 degrees. That means this is, I think, the degrees she's talking about Fahrenheit here. So she's around 40 degrees Celsius. So that's around 40. 102 is around 40 degrees Celsius, which is, of course, too high as a fever. Now we have reading, then we have to answer these questions. Number one, what is the purpose of the doctor's notes? So what is the purpose? Is it to explain patient's test results, or to confirm another doctor's diagnosis, or to describe symptoms and the likely cause, or to inform a patient about a common illness? So the answer is number C, to describe symptoms and the likely cause. Number two, which of the following is a new symptom? Which of the following is a new symptom? Is it runny nose, fatigue, trouble in breathing, or coughing? So she said wheezing. That means trouble in breathing. And number three, what does the doctor recommend for the patient? Rest for a few days, or returning if symptoms improve, or medication to stop the wheezing, or a second doctor's opinion in 7 to 10 days? Of course, the answer is number A, to have some rest for a few days with drinking lots of fluids. Okay, so that was the therapy given to the patient. Now we have some vocabulary related to the topic. So we have cold, runny, cough, wheeze, headache, and muscle ache. So number one, cold. Cold is number F. The cold is number F. It is an illness that causes discomfort in the head and body. Cold. Runny. Yes. So runny here, as you can see the old man in the picture. So we say runny is having liquid leaking from something. So that's runny nose, we say. Runny nose, we say. Cough, it is number E, to force air loudly through the throat. Cough, and this GH is pronounced as F, cough. So it is E, to force air loudly through the throat. Wheeze, wheeze, to breathe noisily and with difficulty. So there is a sound, wheezing. So like breathing like this. So this is wheezing. So that's wheezing. Yes, to breathe noisily. So there is a sound with the breath, and with, of course, difficulty. Headache is number C, pain felt in the head. This is easy. Muscle ache, ache. So this is K. This is a pronounced K, not H. ache, muscle ache. 6 is finally number D, which is pain felt throughout the body. Okay, so we have some, we say symptoms, and there are other symptoms, of course, in your job, and we are going to finish this even further. So we now read the sentences again. We have 2 sentences, and to finish them, choose the correct word. So we have the pain in my back wheezes or throbs. The pain in my back wheezes or throbs. Throbs means comes and goes. Comes and goes. So something coming, going. This is called throbbing. Number 2. Helen was coughing because of the muscle ache or flu. Coughing because of course, flu. According to the thermometer, the patient has a headache or a fever. According to the thermometer, it is, or the patient has a fever. So the answer is fever. Fatigue is a symptom called of the flu. Fatigue is a symptom of the flu or cold of the flu. Of course, it is symptom. And fatigue is a French word. It is not English. It is from French language. Means feeling very, very tired. So fatigue is the feeling of tired. Someone feels very tired because of disease, of course. Now we are going to listen and answer the questions again, true and false. We have here true and false. I want you to listen to the conversation between a doctor and patient. So now we have another conversation. And we answer the questions true or false. Please listen 2 times. We are going to listen twice and then answer the 3 questions. Question 1, the woman believes she has a cold. 2, the woman has trouble breathing. 3, the woman's fever is severe. Now let's listen and answer these 3 questions.
Exercises 6 and 7, page 21. What's the trouble today?
Well, doctor, I don't feel well at all. I'm sure I have the flu.
I'm sorry to hear that. Have you been coughing?
A little, but mostly I'm wheezing. It's hard to breathe.
And have you noticed that your nose is running?
Oh, yes. I've been blowing my nose constantly.
Okay, do you have pain throughout your body?
I do have muscle aches, and I'm so tired that I can hardly do anything. Do you think it's the flu, doctor?
Well, you have a pretty high fever. It looks like you're right about the flu. You'll need plenty of rest, and I'll prescribe something to ease the symptoms.
Okay, now let's listen again.
Exercises 6 and 7, page 21. What's the trouble today?
Well, doctor, I don't feel well at all. I'm sure I have the flu.
I'm sorry to hear that. Have you been coughing?
A little, but mostly I'm wheezing. It's hard to breathe.
And have you noticed that your nose is running?
Oh, yes. I've been blowing my nose constantly.
Okay, do you have pain throughout your body?
I do have muscle aches, and I'm so tired that I can hardly do anything. Do you think it's the flu, doctor?
Well, you have a pretty high fever. It looks like you're right about the flu. You'll need plenty of rest, and I'll prescribe something to ease the symptoms.
Okay, now let us answer the questions. The woman believes she has a cold. No, she said, I have flu. So this is F. She said flu, not cold. She said flu. Okay, and number 2, The woman has trouble breathing. Yes, she said wheezing. So this is true. And the woman's fever is severe, is too high. Severe means too high. This is true again. Now we are going to finish the conversation, as usual, between the doctor and the patient. And we are going to finish these 6 gaps, as usual. Number 1.
Exercises 6 and 7, page 21. What's the trouble today?
Well, doctor, I don't feel well at all. I'm sure I have the flu.
So, well, doctor, I don't feel well at all. I don't feel well at all. I'm sure I have the flu. Okay, 2.
I'm sorry to hear that. Have you been coughing?
I'm sorry to hear that. I'm sorry to hear that. Have you been coughing? Have you been coughing? Have you been coughing? So have you been? So have you been coughing? Have you been, we say sneezing? Have you been, we say wheezing? Have you been bleeding? So you ask these questions. 3.
A little, but mostly I'm wheezing. It's hard to breathe.
A little, but mostly wheezing, but mostly wheezing. It's hard to breathe. It's hard to breathe. Okay, number 4.
And have you noticed that your nose is running?
Oh, yes. I've been blowing my nose constantly.
Yes. And have you noticed that your nose is runny? Oh, yes. I've been blowing my nose, blowing. I've been blowing my nose. I've been, it means I have been. I've been blowing. I've been sneezing. I've been coughing constantly. Okay, number 5.
Okay, do you have pain throughout your body?
I do have muscle aches, and I'm so tired that I can hardly do anything. Do you think it's the flu, doctor?
I do have muscle aches. I do have muscle aches. And I'm so tired that I can hardly do anything. Do you think it's the flu, doctor? Let us see number 6.
Well, you have a pretty high fever. It looks like you're right about the flu. You'll need plenty of rest, and I'll prescribe something to ease the symptoms.
Okay, so you have a pretty means very high fever. Pretty high means very high fever. Okay, now we have finished this one here. And if you look at the language, we say if you ask a patient about his disease, So the patient answers, for example, I think I have cold. I think I have flu. Have you noticed your nose is runny? Have you noticed your nose is runny? Or have you noticed your heart beating? So you noticed? Yes, it's hard to breathe. And one of the answers of the patient, she says, it's hard to breathe. I'm wheezing. Yes. These are some of the issues talking about, we say, the symptoms of diseases. So if you say, does your patient have the flu? That means fever, muscle aches, we say wheezing, coughing, runny nose, and other issues. Recommendations, as you listen to the doctor, he said, you have to drink lots of, you have to take some rest for a few days, you have to drink lots of fluids, and I'll prescribe some, we say, medicine to ease the pain, painkillers like paracetamol and other issues related to painkillers. Okay. Yes, this is the end. This is the end of the class, and inshallah, we are going to meet together next week to finish the issues. As I said, we have only 12 chapters for the semester, and inshallah, after I finish them, we are going to talk about the exam in detail, inshallah. Maybe we have a revision maybe next week about something or some of the issues related to the exam. Again, I want to focus or to talk about the glossary. You have here the glossary. So you have to check the vocabulary here, all of you. This glossary is very, very important. And you have to know the meaning of all these words, all of them, because this is your language. This is the medical language. And as I said previously, the your exam is 80% for the, we say, medical expressions, 80%, and 20% is grammar. So the exam, inshallah, is going to be 80% medical information and 20% grammar. And the grammar is about tenses, present simple, present continuous, present perfect, the grammar we are using in here. Thank you for your coming, and inshallah we will meet again next week, next Tuesday, or the class is going to be Tuesday as today, and at the same time 10 a.m. 10 in the morning. Thank you for your coming, and ma'as salam.